Namaste. I'm Dr. Anushree Muralidharan from Divineveda. We Divineveda as a team are on a mission to create awareness about Ayurveda, yoga, diet and lifestyle correction through YouTube and other social media platforms. We take this opportunity to thank you for the immense love and support you have given Divineveda in our journey. As a token of gratitude from our side, we have started a giveaway of Rs 500 to one active subscriber every week from our subscribers list. For being the active subscriber, you just have to watch the videos and comment your opinion and suggestions in the comment box below. And try to share the video with your relatives and friends. So try to grab this opportunity by watching the videos. Last week's winner is Shrikant Kulkarni. Congratulations, Mr. Shrikant. This week also we have selected a person as the active subscriber of this week. So please watch this video till the end to know who that lucky person is. Today I have come up with a new video about sinusitis. In this video I will be discussing about sinusitis, 4 paranasal sinuses, functions of sinuses, causes of sinusitis, classification, symptoms and diagnosis. So please watch this video till the end to know how sinusitis is caused and how to identify that we are suffering from sinusitis. So let's start the video. Sinusitis is the inflammation of sinus or hollow air cavities in the skull. It is precisely the inflammation which occurs on the tissue lining the sinuses. There are 4 sinuses in the skull. They are frontal sinus, maxillary sinus, ethmoid sinus and sphenoid sinus. Now let's understand the exact location of these sinuses. 2 sinuses in the forehead, that is exactly above the eyebrows, are frontal sinuses. Maxillary sinus is behind the cheeks, that is on the either side of nose. Ethmoid sinus is between the eyes and sphenoid sinus is behind the ethmoid sinus. Each of these 4 sinuses are in pairs. All these 4 sinuses together are called paranasal sinuses. Now let's see the functions of these sinuses. Sinuses helps in warming or humidifying the air inspired and increase the resonance of the voice. It also helps to reduce the huge impact due to trauma on the face. Now let's see how sinusitis is caused. Healthy sinus will be devoid of bacteria or other microbes. In such sinuses, mucus will be easily drained out and airflow will also be proper. But due to some causative factors like cold, allergy, etc., mucus will be produced excessively, which blocks the sinus, due to which bacteria or other microbes start growing more easily in it. The mucus melts due to exposure of heat, which is one causative factor of sinus headache. Moderate production of mucus is normal, but excess production due to cold, allergies, and due to weak immune functions of the body is a pathology. Structural deformities like deviated nasal septum, nasal polyp, nasal bone spur, tumors, etc. also cause blockage of sinus. So sinusitis is basically due to allergy or a hyperactive immune system or due to microbial attack, that is bacteria, virus and fungi. Viral and fungal sinusitis are rare, but they are medical emergencies which require immediate management. Now let us move on to the classification of sinusitis. There are 2 classifications. Firstly, it is classified as acute, subacute, chronic and recurrent. Acute sinusitis usually lasts less than 5 days. Subacute sinusitis lasts between 1 to 3 months. Chronic sinusitis is long-lasting. It lasts for more than 3 months. Recurrent sinusitis occurs very often, maybe 2 or 3 times in a year. It is mostly seasonal and it occurs in extreme cold weather and extreme hot weather. It is also classified as infectious and non-infectious. Infectious sinusitis is caused either due to bacterial growth or fungal growth or viral growth. It may sustain for a long time, so needs proper treatment. Whereas non-infectious sinusitis is caused due to persistent allergy and common cold. It needs consistent care in order to prevent it. It can be prevented by few home remedies which I will discuss in the next video. Now let us move on to the usually noticed symptoms and the causes of each symptom. Headache. Headache is due to the pressure exerted on sinus due to the blockage. Pain aggravates when the patient bends down, looks up, and during exposure to extreme hot weather and extreme cold weather. Facial swelling is noted as the sinuses are filled with kapha. Facial tenderness will also be there, which can be easily identified by pressing the either sides of nose and the upper part of eyebrows. In some cases, fever will be there. It is an after effect of inflammation or infection. It is usually noticed in bacterial, viral, or fungal sinusitis. The patient also experiences nasal congestion and difficulty to breathe as the mucus inside the sinus hardens. Postnasal drip. It is the excess production and dripping of mucus from the inflamed sinus which flows down to the throat. This is one common symptom noticed in most of the sinusitis patients. Sore throat is a symptom which is seen in a few. Some people experience pain in and around eye, ear and teeth. It is due to the pressure exerted by the thick mucus on the nearby nerves, that is nerves near the maxillary, ethmoid, sphenoid and frontal sinuses, which leads to pain behind eyes, ear and teeth. Bad breath is also noticed in a few, especially in those who suffer postnasal drip. Sneezing is also seen in those who suffer allergic rhinitis and sinusitis. It is accompanied by itching and watering of eyes. As a person who suffered sneezing and sinusitis, I have observed sneezing following a weather change or exposure to sunlight. Usually, a sudden transition from an air-conditioned room to sunlight initiates sneezing. Rhinitis or runny nose. Nasal discharge which will be clear or whitish commonly but may become yellow or greenish as disease progresses. Anosmia. It is the complete or partial loss of smell. It is due to the blockage and is usually temporary and reversible. Let us see how sinusitis is diagnosed. Diagnosis of sinusitis is quite simple as it shows clear-cut symptoms like facial tenderness, postnasal drip, and the headache which aggravates by midday and subsides by evening. First, the patient's history should be taken by asking whether the above symptoms were present or not. The physician should also ask for the symptoms which I mentioned before. The second step is physical examination. Physical examination is done by percussion or tapping or slightly pressing over the cheek, forehead and the areas of sinuses in order to find out the presence of tenderness, which is a very important symptom of sinusitis. Moving on to the very important part of diagnosis, lab examinations. Nasal secretion is to be examined in order to differentiate whether it is bacterial, fungal or allergic sinusitis. Eosinophil count in blood should be checked because a high eosinophil count is indicative of allergic manifestations like allergic sinusitis. Presence of bacteria during culture is indicative of bacterial sinusitis. In case of chronic sinusitis or repeated occurrence, doctor will suggest imaging test to reveal the blockage or structural abnormalities like X-ray, CT or MRI. Rhinoscopy or nasal endoscopy is a diagnostic procedure to check the blockage of sinus by using a small flexible tube which is directly inserted through nasal passage. Doctors may also suggest allergy test to identify the causative allergen. I hope you got some information about the basics of sinusitis. Now it's time to announce the active subscriber of this week. The winner of this week is Chidambar K. Congratulations, Mr. Chidambar. The winner should immediately contact us in our email ID contact@divineveda.com. I have done a separate video on the usually given treatment for sinusitis and its adverse effects, Ayurveda perspective of sinusitis, Ayurveda treatment protocol, and the usually given therapies. I have also done a separate video on home remedies which can naturally cure sinusitis. Link of both the videos are given in subscription box below. Please do like this video and comment your opinions and suggestions in the comment box below. You can also comment the topic or health issue which you want me to discuss. I'll try to come up with videos for the same. Also, please subscribe to the channel if you haven't done it yet. Continue watching the videos from Divineveda and keep supporting us. Thank you for listening. This is Dr. Anushree signing out.